Have you ever wondered why your body, designed to protect you, might turn against itself? This is the perplexing and often bewildering reality for those battling lupus, an autoimmune disease. In this strange twist of fate, the body's immune system, ordinarily our steadfast guardian against illnesses, becomes a destructive force, attacking the body's own cells. This isn't a targeted attack either. Lupus affects multiple organs in the body, a sweeping assault that can cause a wide array of symptoms, varying greatly from person to person. It's a mystery cloaked in complexity, a riddle wrapped in an enigma. But fear not, for we are here to unravel this mystery, to shed light onto the shadows of lupus. If this piques your curiosity, then stick around as we delve deeper into understanding lupus. So what exactly is lupus? Well, let's get right into it. Lupus, in essence, is an autoimmune disease. Now, what does that mean? It means that the body's immune system, which typically safeguards us from harmful invaders like bacteria and viruses, gets a bit confused. Instead of focusing on external threats, it starts attacking the body's own cells. Quite a twist, isn't it? This internal misdirection can affect multiple organs in the body, making lupus not just a singular problem, but a multifaceted one. It's like a rogue agent causing chaos in different departments, from the heart and lungs to the kidneys and even the skin. The symptoms, as you might guess, vary significantly from person to person, mirroring the diverse areas of the body that can be impacted. Now, here's where it gets tricky. Diagnosing lupus is no walk in the park. Why, you ask? Well, because of the wide range of symptoms it presents. Imagine trying to solve a puzzle where the pieces constantly change shape and color. That's what doctors often face when trying to diagnose lupus. It's like a chameleon of diseases, ever-changing and elusive. But don't let this complexity intimidate you. Yes, lupus is a challenging disease to understand, let alone diagnose, but it's this very complexity that makes it a compelling topic of study and discussion. And remember, while it may seem like a daunting foe, with knowledge and understanding, we can equip ourselves better to manage it. Lupus, therefore, is a complex and multifaceted disease that requires a comprehensive understanding. So, stick around as we delve deeper into this intriguing subject in the next scenes. Let's unmask lupus together, shall we? Now, what are the signs that someone might have lupus? This question might have crossed your mind as you delve deeper into understanding this autoimmune disease. Well, let's shed some light on this topic. First off, it's important to note that lupus is as unique as the individuals it affects. The symptoms can vary greatly from person to person, making it a bit of a chameleon in the medical world. This wide range of symptoms often contributes to the challenge of diagnosing lupus, but recognizing them is the first step on the journey towards treatment. So, let's explore some of these symptoms. One common sign is extreme fatigue. This isn't just the kind of tiredness you feel after a long day or a poor night's sleep. We're talking about a bone-deep exhaustion that can make even the simplest tasks feel like running a marathon. Next up is joint pain. This isn't a mere annoyance, but a discomfort that can be debilitating at times. It's often one of the first symptoms people notice, and it can move around the body, affecting different joints at different times. Skin rashes are another symptom associated with lupus, particularly a butterfly-shaped rash across the cheeks and nose. This rash can be a telling sign, but remember, not everyone with lupus will experience it. Additionally, some people with lupus might experience sensitivity to sunlight, unexplained fevers, swelling in the legs or around the eyes, chest pain, and even hair loss. On the more severe end of the spectrum, lupus can also affect various organs, such as the kidneys, heart, and lungs, leading to symptoms like shortness of breath, chest pain, and high blood pressure. Let's not forget the psychological aspects of lupus. Many people with this condition report symptoms like depression, anxiety, and memory problems. It's a holistic disease affecting both the body and the mind. It's also important to remember that these symptoms can come and go, often mirroring what's known as a flare. During these times, symptoms can become more severe before they recede again. Now, this may sound overwhelming, and indeed, the variability and unpredictability of these symptoms can be daunting. But remember, knowledge is power. Understanding these signs is the first step towards seeking help and getting a proper diagnosis. So, if you or a loved one are experiencing a combination of these symptoms, it might be worth having a conversation with your healthcare provider. After all, early detection can make a world of difference in managing this disease and maintaining a good quality of life. Recognizing these symptoms is the first step towards getting a diagnosis and beginning treatment. So, let's keep the conversation going and continue to demystify lupus together. But what causes lupus? This question has baffled scientists and researchers for years, and despite the strides made in medical research, the exact cause of this autoimmune disease remains to be fully understood. The general consensus within the medical community is that lupus is caused by a combination of genetic and environmental factors. Let's first delve into the genetic aspect. It is believed that certain genes may predispose an individual to developing lupus. However, it's important to note that not everyone with these genes will develop the disease. This is where the environmental factor comes into play. Certain environmental triggers are believed to activate the disease in individuals who have a genetic predisposition. These triggers could range from exposure to sunlight, certain types of medication, or even a viral infection. The immune system of an individual with lupus, upon encountering these triggers, starts to malfunction. Instead of protecting the body, it turns on it, attacking healthy cells and tissues. Current theories suggest that both genetics and environment play a role, but the degree to which each contributes to the onset of lupus varies from person to person. This is why the disease presents differently in different individuals, both in terms of symptoms and severity. Research in this area is ongoing. Scientists are exploring the role of hormones and studying families with a history of lupus to understand the genetic links better. They're also looking into what specific environmental factors could potentially trigger the disease. This research is crucial because understanding the cause of lupus could lead to more effective treatments and potentially a cure. It's a complex puzzle, but each piece that falls into place brings us closer to comprehending this elusive disease. While the exact cause remains a mystery, understanding these potential factors is key in managing and treating the disease. It's a reminder that in the face of uncertainty, knowledge and understanding remain our most potent weapons. How do we treat a disease as complex as lupus? That's the million-dollar question. With a disease as intricate as lupus, which affects multiple organs and presents a range of symptoms, the treatment approach is just as comprehensive and multifaceted. The cornerstone of lupus treatment is medication. The most commonly prescribed drugs include anti-inflammatory drugs and biologic medications. Anti-inflammatory drugs, as the name suggests, work by reducing inflammation in the body, which is a significant symptom of lupus. These drugs can help manage pain and swelling caused by the inflammation, providing relief to the patients. On the other hand, biologic medications target specific parts of the immune system rather than suppressing it entirely. They're a bit like a sniper in a battlefield, picking off the enemy soldiers one by one. This targeted approach helps to reduce the harmful effects of lupus on the body while minimizing the side effects that can come from more broadly acting drugs. However, it's important to understand that these medications are not a one-size-fits-all solution. The effectiveness of these treatments varies from person to person due to the unique nature of each individual's lupus. This is where the role of a specialist, a rheumatologist, becomes crucial. Rheumatologists are doctors who specialize in diagnosing and treating diseases of the joints, muscles, and ligaments, including lupus. Regular checkups with a rheumatologist are not just recommended, they're essential. These specialists monitor the progress of the disease, assess the effectiveness of the current treatment plan, and make necessary adjustments. It's a bit like having a personal coach, guiding you through the marathon that is lupus treatment. While there's no denying the importance of medication in managing lupus, it's not the only weapon in our arsenal. Treatments, such as physical therapy and counseling, can also play a significant role in managing the symptoms and improving the overall quality of life for those living with lupus. Physical therapy can help improve strength and flexibility, reduce pain, and increase overall physical function. Counseling, on the other hand, can provide emotional support and help individuals cope with the mental and emotional challenges that often accompany chronic illnesses like lupus. To sum it up, treating lupus is a team effort, involving doctors, therapists, and most importantly, the patient. It's a journey that requires patience, perseverance, and a lot of courage. While there is no cure for lupus, these treatments can significantly improve the quality of life for those living with the disease. Can lifestyle changes help manage lupus? Let's delve into this intriguing question. It's no secret that lifestyle alterations can have profound effects on our overall health. For those dealing with lupus, certain adjustments can be particularly helpful in preventing flares of symptoms. First and foremost, maintaining a healthy diet is crucial. While there isn't a specific lupus diet, a balanced intake of nutrient-rich foods can help strengthen the immune system and manage inflammation. Think along the lines of lean proteins, whole grains, fruits, vegetables, and healthy fats. Also, reducing the intake of processed foods and sugars can help keep the body in its prime state. Another important aspect to consider is stress management. Stress can act as a trigger for lupus flares, so keeping it under control is essential. This may involve incorporating relaxation techniques such as meditation, yoga, or even simple breathing exercises into your daily routine. Regular exercise can also have positive effects, not only for stress management but also for overall well-being. Sunlight is another trigger that individuals with lupus need to be cautious about. While a little bit of sun can be beneficial, too much can trigger a lupus flare, so it's important to take precautions when stepping out in the sun. This could involve wearing sun-protective clothing, applying a broad-spectrum sunscreen, or seeking shade whenever possible. It's also worth mentioning that regular checkups with a rheumatologist are key. They can monitor the disease and adjust treatment as needed, providing an additional layer of support in managing lupus. Remember, these lifestyle changes are not a cure-all, but they can certainly play a significant role in symptom management. Ensuring a balanced diet, managing stress, protecting against sunlight, and maintaining regular checkups can all contribute to a better quality of life for those living with lupus. These lifestyle changes, while not a cure, can play a significant role in managing lupus and maintaining overall health. So, what can you do with this knowledge, I hear you ask? Well, there's a lot you can do, and it all starts with taking charge of your health. Lupus, like any other chronic condition, is best managed when detected early. It's about being aware of your body, knowing what feels right and what doesn't, and seeking medical advice when something seems off. Remember, lupus presents with a wide range of symptoms, so don't ignore anything that feels out of the ordinary. One of the most effective ways to manage lupus, or indeed any autoimmune disease, is to stay informed. Understand the disease, know the signs, get familiar with the treatment options. The more you know about lupus, the better you'll be able to navigate the healthcare system, make informed decisions about your treatment, and advocate for yourself. Don't underestimate the power of a healthy lifestyle either. Yes, medications are crucial in managing lupus, but so too are lifestyle adjustments. A balanced diet, regular exercise, stress management, all these can go a long way in helping you manage your symptoms and prevent flares. And remember, you're not alone in this. Reach out to support groups, connect with others who are living with lupus. Their experiences, their insights, their support, these can be invaluable in your journey with lupus. Finally, be proactive. Regular checkups with a rheumatologist are crucial, not just for monitoring your disease, but for adjusting treatment as needed. Don't wait for a flare-up to seek help. Be vigilant, be proactive, and take control of your health. Knowledge is power. The more you know about lupus, the better equipped you are to manage it. So start today, take control of your health.